Hello, my name is Kim Do-hyun. I am a doctor and manage a small orthopedic clinic in the Kano district of Seoul. I am already over 60, and now I receive patients in my area. But for more than 15 years, I worked at a university hospital. Every day I examined numerous people suffering from knee arthritis and performed many joint replacement surgeries. The knee is a topic I have encountered throughout my career, and it is my main specialization. In my clinic, I often hear the same complaints. Doctor, my knee aches when I walk. At night it throbs and I can't sleep. Even climbing the stairs causes intense pain. I hear these words several times a day. The knee is the most important joint that supports our body, and with age, it is the first to signal problems. As a doctor, I spend a lot of time on my feet, moving, and working in the operating room. My own knees are not immune to these problems. Therefore, while examining patients, I often think about my own health. Many believe that with severe knee pain, the only options are medication or surgery, but it is not always so. Based on my experience in the clinic, I noticed that in some cases, pain can be significantly reduced through simple, everyday habits and accessible methods. I particularly want to talk about a method that is great for elderly people and that they can easily try at home, involving a mixture of salt with one additional ingredient. As a doctor, I recommended this method to my patients, and many noticed a positive effect. Of course, this doesn't mean that all pain will disappear just from this, but those who had difficulty moving due to knee pain noted that it became much easier. Therefore, I decided to share this information. If you watch this video to the end, you will learn step by step about the causes of knee pain and methods to manage this pain using salt in everyday life. If you are currently suffering from knee pain, I hope this will be a small source of hope for you. Before we begin, please press like to help others and share your experiences in the comments about your knees. So, let's get started. Dear viewers, there are many causes of knee pain. During patient examinations, I see that everyone has their own reasons and symptoms. The first reason is arthritis. With age, cartilage begins to wear down, causing bones to rub against each other, resulting in pain during movement. In particularly advanced cases, one can hear the sound of bones grinding. The second reason is inflammation. The knee joint contains synovial fluid that provides lubrication. If this fluid becomes cloudy and inflammation occurs, the joint swells, heats up, and starts to hurt. This feeling often intensifies at night, and the pain can worsen when standing, sitting, or climbing stairs. The third reason is the weakening of muscles and ligaments. The knee is not supported solely by bones and cartilage. It is supported by surrounding muscles and ligaments. However, with age, muscles atrophy and ligaments weaken, making the knee less stable. Increased stress on the knee leads to intensified pain. The fourth reason is circulation problems. Especially in the cold season, the blood vessels around the knee constrict, making blood circulation difficult. If blood flow is disrupted, the joint does not receive the necessary amount of oxygen and nutrients, causing the knee to become stiff and pain to arise more easily. The fifth reason is related to daily habits. People whose work requires long hours on their feet or frequent bending of the knees, such as farmers, loaders, or hairdressers, often experience strain on their knees. Additionally, individuals with excess weight put significantly more pressure on their joints, leading to wear from a young age. Thus, knee pain arises from a combination of several factors. Therefore, simply using painkillers or injections does not address the problem at its root. Healthy habits are needed to protect the knees in everyday life, as well as simple home care methods. Now let's figure out why salt can help alleviate knee pain. First, it has a detoxifying effect. Salt, known since ancient times for its ability to reduce inflammation and prevent bacterial growth, is used for disinfecting wounds with saline water. The use of salt for knees works on the same principle, helping to reduce inflammation and swelling. The second benefit is improved blood circulation. When used correctly, salt stimulates the capillaries on the skin's surface, allowing blood to circulate better. Good circulation provides the joint with necessary oxygen and nutrients. When blood flow improves, pain decreases, and joint recovery happens faster. The third is muscle relaxation. Using warm salt helps relax tense muscles and relieve tension. When the muscles around the knee are tense, pain can increase. Salt compresses or massages help alleviate this issue. Fourth, waste removal. Salt has osmotic properties, allowing it to draw out accumulated waste or excess fluid from the skin and tissues, which can reduce swelling and stiffness in the knee. Finally, traditional wisdom. In the past, elderly people suffering from knee or lower back pain would heat salt, place it in a pouch, and use it as a compress. Modern medicine confirms that this method helps improve blood circulation and relax muscles. Now let's consider why the effect is enhanced when one ingredient is added to salt. This is a method using salt and ginger. Observing many patients, I noticed that one of the fastest results is the combination of salt and ginger. Why is the effect so powerful? Let's start with salt. I have already explained why it is effective. Additionally, salt retains heat well, and after one heating, it keeps the joint warm for a long time. When ginger is added, the situation changes. Ginger contains components gingerol and shogal, which warm the body, stimulate circulation, and help alleviate even deep inflammation in the knee joint. Ultimately, the combination of the salt's holding action and the stimulating effect of ginger transforms an ordinary compress into a powerful remedy for joint treatment. I had an elderly patient over 70 who suffered from insomnia due to knee joint arthritis. Even with painkillers, the relief was short-lived, and he woke up 2 or 3 times at night from sharp pain in his knee. I suggested a compress with salt and ginger. At first, he did not believe in its effectiveness, but after a week, he returned and reported that the pain had significantly decreased, and for the first time in a long time, he was able to sleep well. I call it more effective than any medicine because medications can burden the stomach and negatively affect the liver and kidneys, while this compress has virtually no side effects, and with regular use, anyone can feel its effects. If you also suffer from sleepless nights due to knee pain, you can start using salt and ginger this evening. Recently, I talked about how effective the combination of salt and ginger is for relieving knee pain, but the uses of salt do not end there. Today, I will continue and share information about other components that pair well with salt, such as vinegar, alcohol, and sesame oil. When these 3 ingredients are combined with salt, new horizons for treating knee pain open up. The first option is salt and vinegar. Vinegar has long been known for its anti-inflammatory properties. It contains acetic acid, which relaxes muscles and alleviates stiffness around the joint, especially when the knee is swollen and feels hot. In such cases, a combination of salt and vinegar can be quite beneficial. The method is simple. Heat salt, add a few drops of vinegar, and use it. Wrap it in a towel and apply it to the knee. Heat and cold together help reduce inflammation. A female patient I treated complained that even with a small climb up the stairs, her knee would heat up and swell. She took painkillers, but their effect didn't last long. I told her about a salt and vinegar compress. After a week of regular use, she noted that this remedy was much more effective than medications. The combination of the heat-retaining properties of salt and the anti-inflammatory effects of vinegar helped reduce both pain and swelling. The second option is salt and alcohol. Alcohol, especially something like soju, expands blood vessels and activates circulation when applied to the skin. Combined with salt, the pain relief effect is doubled. The method is simple. Heat the salt, place it in a pouch, dampen a towel with alcohol, and cover it on top. Thus, along with warmth, blood flow significantly expands, and heat penetrates deeper into the joint. An elderly patient I treated before said that during the day he feels fine, but at night his knee throbs, especially in rainy weather. I told him about the compress with salt and alcohol, and he noted that even on rainy days the pain became much less noticeable. The alcohol improved circulation, allowing the warmth of the salt to penetrate deeper into the joint. The third combination is salt and sesame oil. Many believe that sesame oil is intended only for cooking. Sesame oil contains a significant amount of linoleic acid and unsaturated fatty acids, which help moisturize the skin and joints, as well as retain warmth. Salt provides powerful warmth, but it can quickly evaporate. Applying a thin layer of sesame oil followed by a salt compress helps retain moisture and warmth simultaneously. This is especially beneficial for those whose knee joints suffer from dryness and stiffness. A 70-year-old woman shared with me that her knees crack and feel stiff. I advised her to apply sesame oil and place a salt compress on top. A few weeks later, she reported that her knees had become significantly softer. Moisture and warmth contributed to improved mobility. The joints felt lighter, as if they had been lubricated. If you have knee problems, be sure to try one of the suggested methods that suit you. Earlier, I spoke about various combinations, but you may be wondering how to apply them. So now I will explain in detail how to prepare a compress, its application regimen, and how long it will take to see results. The first step is the method of preparing a compress pack and the proportions. For the base, you need to heat salt. It is best to use coarse salt, like sea salt. Coarse salt crystals retain heat better, and the compress effect lasts longer compared to fine salt. The process is very simple. Place salt in a pan and roast over medium heat for 3 to 5 minutes. Do not overheat to avoid smoke, just enough to feel warmth when you bring your hand close. Then pour the salt into a cotton bag or wrap it in a towel. Even a clean sock will do. Avoid using plastic as it retains heat. It's better to choose breathable materials. If you want to add extra ingredients like ginger or vinegar, you will need a small spoon of ginger and 2 to 3 teaspoons of vinegar for every 100 grams of salt. It is not advisable to add too much to avoid skin irritation. It's better to limit to a small amount. Secondly, the timing of the compress application and the optimal time of day. A knee compress is recommended twice a day, in the morning and in the evening. The morning compress helps relax the joint that has stiffened overnight, while the evening one removes fatigue and accumulated toxins from the day. A single compress should be kept for 15 to 20 minutes. Prolonged use may lead to skin dryness and discomfort from heat. If during the procedure you feel that the compress is too hot, add another layer of towel or cool the compress for a few minutes and use it again. The third question is how many weeks it will take to see a noticeable effect. Many wonder why there are no results after 1 or 2 applications. Friends, knee pain doesn't appear in 1 or 2 days. It's the result of accumulated habits and joint injuries over the years. Therefore, compresses need to be done regularly. Usually, after 2 weeks, you'll notice that the knee has become softer. After 4 weeks, the pulsating pain or discomfort while climbing stairs will significantly decrease. Among my patients, those who regularly applied compresses for over 3 months were able to reduce their medication intake or increase the intervals between hospital injections. Thus, in summary, first prepare a salt compress by roasting coarse salt and placing it in a cotton bag. Add ginger, vinegar, and other components in small amounts. Secondly, use the compress twice a day, in the morning and evening, for 15 to 20 minutes. Thirdly, to achieve results, it is necessary to adhere to this procedure for at least 2 weeks, and noticeable changes will take 4 weeks or more. This method with salt can be used in everyday life constantly. It is very important as you take your health into your own hands, not relying solely on medications or injections. Friends, a salt compress can indeed have a positive effect on joint health, but one must remember the safety rules that must be followed. Ignoring these recommendations can lead to discomfort or side effects. The first rule concerns people with sensitive skin. If a compress is too hot and applied directly to the skin, it can cause burns, redness, or a burning sensation. Elderly people with thin skin and those who suffer from allergies should be especially cautious. In this case, always cover the compress with a thin cloth to avoid direct contact with the skin. If itching or red spots appear after 5 minutes, stop using it, rest for a day, and try again. The second rule is to never apply the compress to damaged areas of skin. If there are wounds, injections, or insect bites on the skin, using a hot saline compress will only worsen the pain and injury. Additionally, salt can intensify the burning sensation upon contact with open wounds. Therefore, use the compress only on intact skin and only after the wounds have healed. The third rule is to be cautious if you have high blood pressure or kidney diseases. Although salt is used locally and in small amounts, excessive use can lead to its accumulation in the body. People with hypertension or kidney problems should be especially careful about salt intake and use compresses less frequently. For example, instead of twice a day, they can limit it to once when symptoms are particularly severe, or use it 3 to 4 times a week for effect. The fourth rule is that if the compress becomes too hot, do not endure it. Immediately add another layer of towel or cool the compress for 1 to 2 minutes before using it again. Do not think that patience will lead to a better effect. It may harm the skin. In general, remember, first, people with sensitive skin must cover the compress with a towel. Second, do not use on damaged skin. Third, be careful if you have high blood pressure or kidney diseases. Fourth, if the compress becomes too hot, cool it down. By following these 4 recommendations, you can use a salt compress more safely and effectively. Friends, improving joint health cannot be achieved solely with a compress. The effect will be significantly stronger if combined with proper daily habits. The first is physical activity. As we age, the cartilage in our joints naturally thins. Excessive strain on the knees only worsens the damage. Therefore, light physical exercises with low impact, such as walking, swimming, and cycling, are the best options. Swimming is especially beneficial as the water supports the body, reducing stress on the knees and evenly engaging muscles throughout the body. A saline ginger compress applied before and after workouts will help relieve joint stiffness, improve circulation, and enhance the effects of exercise. The next aspect is the sleep mode. Many suffer from insomnia due to pulsating pain in their knees. In this case, it is helpful to apply a warm saline compress to the knees 30 minutes before sleep. This will relax the body and muscles, significantly improving sleep quality. It is also important to choose a medium-firm mattress, neither too hard nor too soft. Placing a small pillow between the knees while sleeping reduces pressure on the joints and alleviates pain. The third point is dietary habits. Protein and calcium are essential for bone and cartilage health. Don't forget about vitamin D, magnesium, and omega-3. For example, try to eat calcium-rich foods like tofu, anchovies, spinach, and fish like salmon or mackerel several times a week. If that's difficult, supplements can be used. In addition, fruits and vegetables containing antioxidants will help reduce joint inflammation. Maintaining such dietary habits and combining them with a salt and ginger compress can lead to a synergistic effect for knee discomfort. Let me provide a real example. 72 years old, Mr. Kim from Suwon, Gyeonggi Province, suffered from degenerative arthritis, his knee swelling after just 10 minutes of walking. At first, even medications did not yield significant results, but he began to regularly use a compress with salt and ginger twice a day, in the morning before a light walk and in the evening before bed. After a month, the swelling noticeably decreased and movements in the knee became much easier, as he noted. Of course, the pain did not go away completely, but if before he could only walk for 10 minutes and then rest, now he can walk for 30 minutes without problems. Thus, the saline compress is not the only treatment method, but combined with exercises, proper sleep, and nutrition, it provides a powerful effect. Today, I shared with you a special method of using salt and ginger to relieve knee conditions. In conclusion, the combined use of salt and ginger creates a warming effect and improves blood circulation, which significantly helps reduce stiffness and pain in the knee joint. In addition, other combinations can be used, such as salt with vinegar, salt with alcohol, or salt with sesame oil in everyday life. The principles and examples I mentioned can be adapted to your situation and individual characteristics, so choose a convenient and consistent method. But remember, this method is not magical to instantly eliminate pain. With regular and proper application, the quality of life will gradually improve. I always emphasize this to my patients in the clinic. Do not rely solely on medication. Incorporate simple methods into your daily life. I hope this information serves as a small hope for the health of your knees. If you decide to try it and notice changes, please share your experience in the comments. It will help others. If the information was useful, don't forget to like and subscribe to receive more relevant and practical health tips in the future. Thank you for watching the video to the end. I wish for your knees to become light and free. That's all.